the little yellow pill, Cialis. As of this point, tens of millions. Back in 2014, over 40 million men had taken this pill to help their erections. But that's not what this video is about anyway. It's about the top 5 hidden benefits of Cialis that you have not heard about. Let's look at hidden benefit number 1. Cialis helps reduce trips to the bathroom. Now, if you're losing sleep because of the urge to urinate, maybe you're dealing with LUTS. What is LUTS? This stands for lower urinary tract symptoms. What are they? Well, as I mentioned, getting up to go to the bathroom, frequent urination, slow stream, splitting or spraying of the stream, a boggy feeling in your pelvis, spasm when peeing or having orgasm, and terminal dribble. You men who are listening may remember that old bathroom joke. You can wiggle and you can dance, but the last 3 drops still go down your pants. Now, the leading cause of LUTS is another acronym, BPH, benign prostatic hypertrophy. In 2011, Cialis was the first and only drug approved by the FDA for both ED and BPH, benign prostatic hypertrophy. By the way, again, Jesus, Dr. JV, the channel manager, might have known that and gotten that into the script if he'd been spending more time studying and less time giving me grief. Now, let's get back to the script. Speaking of, if you are over 50 years old, there's a 50% chance you already have BPH. If you're younger, you still may have it. Plenty of 40-year-olds get it. I got it in my mid-40s. And think about this. Forewarned is forearmed. It's better to start preventing something earlier rather than waiting for 2 decades, like I did, and suffer some tissue damage. What has Cialis got to do with BPH anyway? A 2016 meta-analysis showed that 5 milligrams of Cialis daily for 12 weeks reduced the symptoms of LUTS, lower urinary tract symptoms, or benign prostatic hypertrophy. And it did it with few side effects. We'll talk about side effects a little bit later in this video. But let's talk about the science and the mechanism. In order to do that, we're going to have to get a little bit geeky. Hang in there, it won't last very long. Tadalafil, also known as Cialis, is what we call a PDE5 inhibitor, phosphodiesterase 5 inhibitor. Now, what's that? Well, PDE5 is an enzyme. What we do need to know, and we don't need to know any more than this, inhibiting the PDE5 enzyme increases nitric oxide. Why is it so important, nitric oxide? Well, it relaxes the blood vessels. So those spasms I was talking about, the inability to pee that I was talking about, those improve significantly with this medication. You pee easier. You empty your bladder better. And because you're emptying your bladder better, you're not getting up every couple of hours in the night and then having a problem going back to sleep. So Cialis also modulates the nerves within the bladder, feeling less irritation. Let's talk about benefit number 2. Cialis improves prostatitis. Well, now, what is prostatitis? Break it down. Prostatitis, inflammation of the prostate. Now, you need to be aware that most of this is bacterial infection. So just taking Cialis alone is not going to clean up a bacterial infection. Another thing you need to know is that there's acute and chronic prostatitis. Acute prostatitis, believe it or not, can be a life-threatening issue because it can cause sepsis, a very serious, even occasionally lethal infection of the bloodstream. So prostatitis of either type is different from BPH because you've got that infection, you've got the inflammation going on. BPH is just, as it says, a benign swelling of the prostate. Cialis does reduce the symptoms in chronic cases of chronic prostatitis. One of the problems with prostatitis is pain. But there are other symptoms as well, like fainting. I mentioned that I've had some challenges myself in terms of men's health. I've had acute prostatitis 3 times. Do not mess around with that. Sometimes I've known better but waited too late. And yes, it took me a day or 2 longer than it should have to get in for acute prostatitis to see a doctor. Now, I had problems with fainting the first 2 times. Now, why would fainting happen? Well, you could say I'm a prostatic wimp, but I don't think that's the issue. The prostate, as well as other internal organs, are usually innervated by the vagus nerve. The vagus nerve slows you down, decreases your blood pressure, and overstimulated can lead to fainting. Let's go back and talk about benefit number 3. Cialis improves chronic pelvic pain syndrome. Again, another men's health issue very much related to the first 2. This is pain from the pelvis and genital area. But how does Cialis work here? Remember, we mentioned it a few minutes ago. Cialis, tadalafil, relaxes the bladder neck. Evidence suggests 5 milligrams a day for 4 weeks can help significantly. I'd love to hear from you if you've used Cialis successfully for any of these problems. The point here is men often deny their health problems. Cardiovascular disease sometimes gets our attention, but quite often something like prostatitis may take some time, especially when the medication, the treatment for it, often is overshadowed by sex, by erectile dysfunction. So people begin to think about, I'm not going to take that pill. It's for erectile dysfunction, and I don't have that. Or you may feel guilty asking for that medication. Or there's a bunch of reasons why men tend to ignore men's health. Now, let's get beyond urinary problems for a minute. Let's move to hidden benefit number 4. Cialis decreases blood pressure. Due to its effect, remember, on nitric oxide, which relaxes the blood vessels, it can decrease blood pressure. Many men, by the time we're boomer age, 50s, 60s, 70s, are already on high blood pressure medicines that will drop their blood pressure, like beta blockers, metoprolol, atenolol, carvedilol, and alpha blockers. The most commonly known and used alpha blocker is Flomax, again, used for a very similar problem to help increase flow through the prostate. Be careful about taking Cialis with either beta blockers or alpha blockers, and think about one other thing too. Nitrates. Remember nitroglycerin, isosorbide, medications that you take when you have angina. When you take nitrates, these medications for angina, or alpha blockers, or beta blockers, and you add PDE5s, the little blue pill or the little yellow pill, you can get dangerous levels of decreased blood pressure. So if you're thinking about replacing one of your medications, like a beta blocker, or an alpha blocker, or a diuretic, one of your blood pressure medicines, one of your prostatic flow medicines, remember that the PDE5, the Cialis, may help you with ED, but also help in terms of managing blood pressure. So you may have to go off of one of the other medications. Before I get off of this impact on blood pressure, let me just make one other statement. Be very careful if you're having potentially a heart attack. If you have chest pain, it's not going away, you call the EMS, they come to pick you up. Be aware, quite often the paramedic will want to try giving you a nitroglycerin or one of the nitrates to see if that decreases the heart pain on the way into the hospital. That, if combined with Cialis, can give you a dangerous drop in blood pressure. So again, be aware of these interactions with other medications. In summary, with all this information about blood pressure, don't do any of this without your doctor. See your doctor, talk with him or her about what's going on, and come up with a plan. Now, there is another type of high blood pressure Pulmonary hypertension. That's high blood pressure in the arteries of your lungs. It's very much associated with heart failure. It can cause heart failure. It can be caused by heart failure. And those of us who are in their 80s and 90s, it's far more common than you think. Cialis at higher doses, 20 milligrams, for example, helps with pulmonary hypertension or high blood pressure of the arteries that go to the lungs. Actually, PDE5s, the blue pill, the yellow pill, Viagra, and Cialis, the whole class of drugs were developed for this issue, pulmonary hypertension. Here's what happened. They were working on this new class of drugs for people that have heart failure and pulmonary hypertension. And then they saw that a lot of men were having erections, greatly improved erections. And guess what? Big Pharma did what Big Pharma does. They looked for an opportunity to make a whole lot of money. And that's what they did. They made a whole lot of money with the Viagra and Cialis. But a whole lot of men and women have benefited from that. Cialis does help with pulmonary high blood pressure, even in women. Before we go to the last hidden benefit, let's talk about side effects and misperceptions. One of the main side effects for Cialis is low blood pressure. We've touched on that multiple times already. But there's another one called priapism. That's an almost permanent erection. And before you start, your mind goes where I think it's going to go, and back to the bathroom jokes, think about it. This can be a real medical emergency. I remember having a case of a young man come in. He was 18 years old. He had sickle cell anemia. This was during my internship about 40 years ago. We did not have the PDE5s at that point in time. And sickle cell is a well-known cause, quote, natural cause for priapism. When the sickle cell trait can help prevent or protect against malaria. But when you have full sickle cell, one from mom and one from dad, you can get what's called sickling of the red blood cell. The treatment at that time was an ice water enema. And again, that's not pretty. That's not comfortable. There are even side effects with tissue loss associated with priapism. Before you get your eyes too wide open and say, I'm never going to take this, even if I have men's health problems, remember this. That's not common. It's not common at all. In fact, the most common side effects are just headaches and muscle pain. Now, let me focus on something else while we're talking about side effects. If you paid attention, I've been quoting daily doses of 5 milligrams, 20 milligrams for people that have heart failure and pulmonary hypertension associated with that heart failure, but 5 milligrams for men with LUTs or BPH or chronic prostatitis. You might think, well, taking a daily dose gives you more risk for side effects. That's not really the way it works with Cialis. It works with higher doses. So higher doses lead to more side effects. That's not surprising, but daily low dose does not. There's the story about the man that took Cialis and the Cialis caused a heart attack. You hear about it in jokes, you hear about it in movies, and the guy took the blue or yellow pill and then kicked the bucket, died in his last performance in bed. Now, in reality, multiple papers have shown that Cialis does not do that. It actually might help prevent that, which leads us to hidden benefit number 5. Can Cialis really reduce cardiovascular mortality? Some studies in mice and adults with ED show that Cialis improves endothelial function. You remember the endothelium, the intima? It's that delicate lining of the artery wall. It's also called the glycocalyx. When people have prediabetes or diabetes, what's happening is those high blood glucose levels, those high insulin levels are damaging that very fragile glycocalyx, causing vascular inflammation. Now, is there the potential that Cialis improves endothelial function? Well, not only the potential, but yes, there is evidence in research indicating that. Let's go back and let's talk about the other side of this. If you're taking away from this a statement from me, if you're thinking I'm saying, hey, don't worry about lifestyle, don't worry about all your other stuff, just take Cialis. That's going to prevent your heart attack. You haven't been listening. And if you've seen any of our other videos, you also know exactly our position. There is no medication, whether you're talking about the ever-popular statins for this issue, PCSK9's the new high-tech biological drug for this, bempedoic acid, other new drugs, sequestrants, ezetimibe, any of those things, none of those have the kind of impact on your cardiovascular risk that lifestyle does. You cannot out-prescribe or out-medicate a lifestyle. You cannot out-supplement a lifestyle problem. You cannot out-stent or out-bypass a lifestyle problem. It's lifestyle. And when it comes to lifestyle, diet is king. You cannot outrun a bad diet. You cannot outlift or outwork a bad diet. That's just the way it is. Let's get back to Cialis. The main takeaway is this. There's evidence that supports it might even help with the health of our arteries. Mostly for men with ED, there's just been very little evidence focused on people without it. Remember to talk to your doctor. The issues about and the side effects associated with low blood pressure can be very serious and can be very complicated, especially when you take the other medications that boomers often end up taking, like blood pressure medications or angina medications. So, especially if you have history of low blood pressure or are already on blood pressure meds, again, speak to your doc. If you have a heart, liver, or kidney problem, speak to your doc. Now you know the signs, the top 5 hidden benefits of Cialis. But more than anything, how men tend to ignore men's health problems because we're so focused on some of the sexual benefits associated with drugs like Cialis. So, Cialis might not be the best medication to reverse plaque. Again, we've already talked about that. Lifestyle is the key. It's far more important. A couple of our more popular videos have to do with my own experience, how I thought I was doing everything right for my cardiovascular risk. And then I saw evidence of plaque that was just so frustrating and devastating. Again, I taught this at Johns Hopkins. I thought I knew what I was talking about, and I practiced what I preached. But I had some things to learn. If you'd like to see that video, it's right here.